Hi, and welcome back to In the Gray Area with REVV Health. I'm Brittany.
And I'm Travin.
And today we're going to dive into a topic that has not only shaped but also harmed many women's health for generations. Let's talk about the Women's Health Initiative.
Today, we're excited to welcome back our provider, Lisa. We thought it'd be great to have her because she's having these conversations nearly every day with women. And so we thought it'd be good to get your perspective on how this comes up and the things that you utilize to help women overcome kind of these preconceived notions that they have.
Sure. It's good to be here today, and I'm excited to talk about menopause because it's near and dear to my heart because I'm in it. So, and also really looking out for our patients' health and welfare. So, I graduated from my master's program in 1997, and that was before the WHI came out, or the Women's Health Initiative. And at that time, clinically, we were noticing a lot of women who were coming in with perimenopausal symptoms. And we were placing them, kind of our go-to was Prempro at that time, which is a combination of Premarin, which is horse pea estrogen, and Provera, which is a synthetic progesterone. And what we were noticing is those women on those hormones were having less breast cancer and less cardiovascular disease. So it was decided by the powers that be that the Women's Health Initiative should happen. And it was very well supported by Prempro because they stood the possibility of having every woman over age 50 placed on their drug. So they were very much supporters of the WHI. The WHI, by the way, is like one of the most expensive drug studies that have been done to date. It was crazy, and it had a huge amount of women involved in it. So when I first started practice, I was regularly placing people on Prempro, and they were feeling great. But then WHI happened, and everything changed. Shortly into the study, they removed one whole arm of the study. So at that time, there was 4 arms. There was the placebo group, the Premarin only group, and the Prempro group. And I believe that there was a progesterone only group, if I'm remembering correctly. Right away, the combination arm was discontinued because they were noticing increased heart attacks, cardiovascular disease, and breast cancer, which was completely because it was a bad study. And we know that now, but we didn't know it then. They were accepting people. I know, Brittany, you wanted to talk kind of about the 5 kind of problems with the WHI, if you wanted to go into that.
Yeah, I know that when we've looked into it in the past, the average age woman was 63. And like from my understanding, they didn't do any tests prior to even putting the women in the studies. So they didn't know if they had pre-existing issues, symptoms, even like cancer and whatnot. Is that correct?
It is. Even some of the women were smokers, and some of them had previous heart attacks that were placed on the program. So,
yeah, so there was no screening whatsoever. Maybe you could kind of explain some of the other reasons on why this was the worst study ever done.
It is crazy, the flaws in the study. First off, they used the wrong hormones. They used Premarin, which is horse pea, estrogen, which is very inflammatory to the human body. They also used Provera, which is a synthetic progesterone, which is very also inflammatory and not protective. They, like you said, they chose the wrong group of women. Instead of starting with women who were like in perimenopause and going through, like 10 years post-menopause, they were selecting these women who shouldn't have been in the study at all.
I think even, part of it too was some of the women were, they were all supposed to be hormone naive, meaning none of them had previously been on hormones, but then they found out that wasn't even true. And so there's just all these things that kind of like threw a wrench into it that skewed the results. And
but even the results were skewed.
Well, yeah. And it's interesting because it was such, I was, at an age at that time, and I wasn't even paying attention to this stuff, but I remember it was such a big deal to where it was even all over the media on how dangerous hormones were at that time. And it was like everywhere. And then now there's like all these years later, and and they're finding like all these flaws in the study and negating all this stuff, and it's been super quiet, right? So it's like the alarm bells went off back then, but it's like that same attention hasn't been put on. No, wait a second, like we actually misinterpreted this. The study was incorrect. Like we do know that a lot of these hormones, especially bioidentical hormones, are safe, but you have now a whole generation of women that have been deprived of these hormones, and you have a whole generation or more of doctors that still kind of hang their hat on that and are still to this date thinking that these hormones are harmful.
Well, even the positive results coming from it. So the Premarin only branch actually had a significant decline in the amount of breast cancer that they were showing. So even the good results from the tests were like diminished. Like nobody talked about the good effects of Premarin on the breast tissue. They only talked about the effects of Premarin on cardiovascular disease. So it just is a study that should have been ignored. And, you know, it's been 20 years of women who have had to suffer through perimenopause and menopause without the beneficial effects that they could have experienced with bioidentical hormones.
Exactly. And that's the point I was going to make, is that you had mentioned like even some of the positive results that came from that study, and that was still with the use of synthetic hormones, let alone like the bioidentical hormones, which we know cause no harm whatsoever.
Right. They, like you said, the clinicians are still hanging their hat on those results rather than looking at the new studies done with bioidentical hormones and the amazing results that they're getting. So what happened in my practice is we immediately took all of our patients up on PremPro. So if you can imagine like these women going through basically hormone withdrawal, they were miserable. And then I would have patients coming in who were having hot flashes and night sweats and all of the symptoms of perimenopause. And we're putting them on antidepressants and anti-anxiety medicines and all of these other things because we were scared to put them back on that. And to this day, providers are hesitant to put people on hormones. And what's crazy about it is it's just increased all of the in-cause deaths from heart attack and stroke and breast cancer and all of the things that hormones can and obviously help with.
It's not hard to look. I mean, you can directly draw like a linear line of like when women lose hormones and then the risk of some of these diseases. I mean, it's really not hard to see the correlation.
Sure. And, you know, the breast cancer risk, it's just scary. I mean, that's the reason I hesitated on going onto estradiol, is because my grandparents both had breast cancer. My aunt had breast cancer at a young age. And in my mind, you just kind of always think of that WHI result and what if it was right, and like trying to retrain myself that it's wrong. It's not the truth about bioidentical estradiol, which is so protective.
That's exactly, like, not only does it not cause harm, it actually provides protective benefits against that stuff.
And I still to this day have patients who are coming to me here at REV who are still being told by their primary care provider that they need to go on the lowest possible dose of hormones and take it for the shortest possible time to be safe, which is the opposite of what's true.
Mm-hmm.
So,
yeah, I remember that was just yesterday or the day before that happened. Yeah.
I think there's just still so much fear that's driven in women, and even from the older generations, like talking to some of our patients, because we'll have patients that we get them dialed in, they're optimal, they feel great, but then they talk to a friend and their friend is like freaking out and telling them like, you have to stop this. Even though we are providing them with that, you know, the studies to show them and whatnot, we still are overcoming that huge sense of fear that's been pushed into women for so long.
crazy.
It is.
I think all we can do is just try to educate and give them all the information, and hopefully they can make a decision for themselves that's positive.
Yeah, and we do know, obviously, you were seeing great benefits and results back then, but now we do have these bioidentical hormones that we're using. Maybe you can even explain a little bit of the difference between the two?
Mm-hmm. So truly, when you're looking at a synthetic estrogen, it's much, much different than the bioidentical compounded estradiol as far as its effects on the body. Doesn't have that inflammatory effect, has significant improvements in brain health and heart health and breast health and bone health. So it's pretty much the entire body eyes too. So.
Mm-hmm. Yeah. Yeah. Well, the synthetics, and they cause, metabolites that are, unnatural to the human body, and your body doesn't know how to process those things. And that's what causes issues. Whereas, like, we tell people all the time, like bioidentical hormones, your body processes them exactly the way it does the hormones that it naturally produces. There's literally no harm from doing that.
Yeah. And then looking at, the synthetic progestins versus bioidentical progesterone, especially with breast health, it's pretty amazing that it significantly decreases your risk of breast cancer and uterine cancer. So pretty amazing changes there, that the opposite is true with progestin. So, we've got women coming to us who've been on birth control pills for years, and they're hesitant to start bioidenticals, but they've been taking these synthetics for years that are terrible for them. And so trying to reteach them that this is healthy. The birth control pills were not, this is.
Yeah.
And trying to get past that bias, because when they Google and look online, when you put in progesterone, it's coming up with the progestins, and they're believing those results are the same as bioidentical progesterone, when it is entirely different.
That's what's hard, because I see that all the time with estrogen and progesterone. It's when people start doing their own research, and a lot of times those words get interchanged. And so when you're looking at certain things, and a lot of people don't understand how to, navigate that and understand if it's actually a synthetic hormone or a bioidentical hormone that whatever they're looking at is referencing. And so it causes a lot of fear and confusion.
I have, several articles that really go into detail of the differences. So if any of you out there are wanting to see some of that information, reach out to us, and we can refer you to those articles. So they're really helpful.
What are some of the differences that you've seen since working with us and treating patients differently? What are some of the improvements and benefits and symptom relief that you've seen going this route?
So, like I said before, when we were no longer using hormones in primary care, we were having to use all of these other pharmaceutical medications to cover up, to kind of band-aid the symptoms people were having, rather than dealing with the underlying issue. And so by using bioidentical hormones, we take care of that baseline problem, and all of the other stuff just goes away. I mean, it's amazing, even at the 2-month check, to see the improvements in lipids and their insulin resistance, and all of the other things that come with hormone deprivation, really.
Have you ever seen markers like hemoglobin A1C dropping as dramatic as we see when we
No, in primary care, when I even dealing with metabolic syndrome and diabetes and putting them on medications for those, it was really hard to get their hemoglobin A1C to move at all. And typically, when I do the 2-month recheck on our patients here, there's dramatic improvement in their hemoglobin A1C. It's crazy.
So we've talked about how bioidentical hormones are safe and they're really not dangerous, and it's not something that people should be scared about, and all the misinformation out there. But maybe you could just kind of help women understand, like, what's a good age to start addressing these symptoms?
Well, really, as early as they can. I liken it to a new fence. If you build a new fence, a lot of women are wanting to go through perimenopause and menopause naturally. That's what I hear a lot, is I want to do this naturally. So let's look at that analogy of a new fence. If you put up a new fence and you don't put anything on it, you don't take care of it, first thing that happens, it starts changing color, right? And then eventually it starts breaking down. Same thing happens with the female body. If we start losing our hormones, we slowly start noticing things on the surface, kind of mild things. Well, some people don't think of it as mild, but dry, wrinkled skin and vaginal dryness and not sleeping well. But then eventually you start getting more breakdown. Like in the fence, you get some rot, some mold that's growing on it. The fence actually starts breaking down and falling apart and not functioning right anymore, right? So the human body, what happens is women start developing macular degeneration of their eyes, dementia in their brain, or brain fog or confusion, muscle breakdown, bone breakdown, breast cancer, cardiovascular disease, diabetes, vaginal infections, UTIs, vaginal dryness, painful intercourse, decreased libido. So all of that comes because there's not the hormones there to support the natural thing. So when do you want to start it? Well, with a fence, you want to start treating it before it starts discoloring. So as soon as women, or even prior to women going into perimenopause, if we're testing them and we're seeing them have deficiencies of progesterone or estrogen or thyroid or testosterone, start fixing it now. Don't wait until you start having these terrible symptoms.
Yeah.
Let's get ahead of it and prevent the
Yeah.
disease.
That's like we always say, yeah, be reactive rather than proactive and preventative, rather. So pretty much with the exception of estrogen, I mean, you can start addressing all of the hormones whenever it's related to kind of symptoms that you're experiencing. And we want to correct those symptoms by optimizing the hormones.
That's a really good point, Travin, because you don't want to start oral estradiol before a woman is in menopause. So we do FSH and LH testing prior to starting women on any hormones to make sure that they're in menopause prior to starting estradiol, because if you're not in menopause, you'll get a lot of adverse side effects and risks based to starting estradiol too early.
And that really goes for any type of estradiol. Like we just recently had like a 36-year-old come in here that she clearly was not in menopause, and she's already on the patch, and they have her on a really low dose of progesterone. So, I mean, outside of even giving women birth control to cover these symptoms, like they're actually causing danger by giving women who are clearly not in menopause estradiol, especially.
Right. And that's another good point, is that if a physician or your provider places you on estradiol without progesterone, that's a huge red flag. That's very dangerous. Even if you've had a hysterectomy, do not take estradiol without progesterone. It's really vitally important.
Yeah, I'm glad you mentioned that, because we see that almost like shockingly too much.
A lot
more than we should.
Yeah. Well, thank you again for joining us today. It's so nice to have your perspective on this topic. And like always, please like, comment, share, and subscribe, and we'll see you next time. Thank you.